So how do we actually start talking about death and dying and end of life? Some interesting statistics, and these statistics come through dyingtotalk.org.au and palliative care. 82% of Australians think that it's important to talk to their families about how they would want to be cared for at the end of their life. So we actually hold it as a thought that we should do this. Conversely, only 28% of people have actually done something about that. And I'm probably one of those. I had a recent need to go into hospital, and my husband said to me, do you have anything written down? The hospital said to me, do you have anything written down about what you want at end of life, just in case? And I actually didn't. I can verbalise it, but we hadn't actually talked about the details of that conversation. Communicating our needs and our wants before the end of life, well before the end of life, is crucial in determining the quality of care and the quality of the end-of-life care that is provided. When we take the time to sit down and truly think about what it is that we want and what we want that to look like, and we communicate with that, the people who love us and the people who are around us who are providing services, and hopefully document that as well, that creates the best scenario for that situation in terms of services, anyone who's contributing to that care to be able to move into that space in relationship with you and provide what it is that you need in the way that you want it yourself. Talking about death and how we want our end-of-life care to be dramatically improves health and wellbeing outcomes at the end of life. So having those conversations early, having those conversations with people who need to know what it is that we want, close family, close friends, our enduring guardians, the people that we have identified as being our spokesperson if for any reason we're unable to speak at that point in time. And as a carer, having been in that situation, incredibly relieving to have had those conversations because I knew what the people in my life wanted that I was caring for. This little video is a wonderful summary of all of that, and I'll let you listen yourself.
You must have known I didn't want to go into the hospital. I wanted to stay at home in my bed with my things and my Jasper. And your father, Jeff, why on earth would you invite him to the hospital? We'd been divorced for 23 years.
I thought you were still close.
Appearances, you sweet, silly girl. I couldn't bear the sight of him. I suppose I should be grateful I didn't have to talk to him. But you didn't ask, did you?
You never said.
No, I didn't, did I? Oh, well, I guess you'll know next time I die. Come on, where's your sense of humour?
Incredibly powerful little video, very short but very poignant from both the person's perspective who has died and from the carer's perspective. The person who had the life-limiting illness perhaps didn't take the time or wasn't afforded the opportunity for whatever reason to sit down and have those conversations and have that information documented for the carer, for them to be able to know accurately, clearly what it is that that person who is facing that illness wants and needs. It deepens that relationship. It gives people the opportunity to provide the care that's wanted and to receive it. Beautiful opportunity. There we go. Tickle. So as I mentioned before, for people to have the opportunity to be able to record that information, what we're going to do is just have a look at a little bit about the documentation process or what can happen to make sure that our wishes and our wants for end of life are recorded. To start that, have a little bit of a think for yourselves and perhaps pop it down in the chat if you'd like to. Think about how you would start a conversation about death to a loved one, to a neighbour or to a relative, and that could be perhaps about their death. It may be about your death, anyone's death. How would you start that conversation? What sort of questions could you ask to actually open the door in a way that perhaps gave a little bit of comfort or a little bit of reassurance, maybe add a little bit of humour so that that conversation can begin? And if you'd like to, pop it down in the chat for me. That would be lovely. What sorts of questions could you start a conversation with around end of life with someone that you love? It's a beautiful phrase. To die well, we actually need to plan well. We plan everything in our lives. We plan births, we plan our weddings, we plan all our important activities that we deem important. And our end of life is just as important, and it does need that. It can be afforded that time and that level of interest. So have a little bit of a think. Is there anything there in the chat box, Ruth?
No, there's not at the moment.
One that always works for me is, what sort of music would you like played at your funeral? I had a wonderful conversation with my husband about this many weeks ago in the car, and he said to me, I don't know. So I said to him, can I play AC/DC? He said no. So there are some lovely little opportunities, conversation starters.
Here's one, Carolyn. In what circumstances would you not want to be resuscitated?
Absolutely. Absolutely. So for someone who's facing a life-limiting illness and is very clear in their own mind, they do not want to be resuscitated. To have that information written and recorded in a legal document, and I'll talk with you about that in a moment, so that that information is shared particularly with medical staff and hospital staff. Ways of doing that so that that information is very clearly shared. When I was caring for my mother, each time we went to the hospital, I would always take with her a copy of her advanced care plan, her advanced healthcare directive, so that we had that information there to be able to pass to medical staff so that her wishes were to be followed. They had that information so that they could honour her honour and respect her in her wishes that she wanted for her end of life.
And another one, Carolyn. Who do you want to make decisions for you if you're unable to?
Yes, yes. So incredibly important to have all of that information and lots of other topics as well. I'll talk to you about that now. So there are a couple of resources and I'll lead into them. This little document called the Collaborative Care Plan, when we were talking before about the lady who identified ways that she could be helped in her home around gardening, someone doing the shopping for her, someone perhaps taking the unwell person out for the day. This is a lovely little document to help families start to talk about some of these possible care needs that will support both the family or the carer and the person who is facing that illness. And what I'll do, Ruth, is I'll send you through the links for these as well. You'll have the recording, but I'll send you through the links for these documents as well.
Great.
Another little document that can help to start some of those conversations, the final checklist. So this is a document that was actually put together by the Groundswell Project as part of Dying to Know Day, which is an annual day that's usually determined around the 8th of August. With COVID this year, it's been anywhere in August and anywhere in September that some of this information has been shared and talked about more so. But this final checklist is a great little document to be able to take and perhaps, have a little bit of a discussion over at a family dinner. Say to everyone, Let's have a chat about this. I want to share with you what I want. I want to be able to talk to you about my needs. And that applies to anyone. This is something I actually need to revisit myself. So a little bit of a checklist there around some of the documents that you might like to have in place. Is your will up to date? Have you nominated your power of attorney? So that person who can be in charge of both your financial affairs, if you're unable to, an enduring guardian who can be responsible for decisions around medical needs if needed. What are your important documents? If you have children, who will be their legal guardian? If you have young children. Also, if you have pets, who's going to care for your pets if you're not here anymore? Information for your loved ones. Have you discussed your end-of-life plans with family and friends? So this can be a little bit of a personal checklist for you, and also a lovely document to be able to start some of those conversations with family and friends. In terms of formally documenting your wishes for end of life from a medical perspective, an advanced care directive is the way to do that. So just there on the screen is the link to that document. If you type in advanced care directive in Google, that document will come up. And that document has been contributed to and developed jointly with Palliative Care New South Wales as well. So it's a wonderful document in terms of talking about or just responding to that information that was put in the chat session around under what circumstances do you not want to be resuscitated. All of those types of questions are raised in this document. And then that document is signed off by your doctor. There's processes in place to make sure that that document becomes the final say that you have around what it is that you're wanting for end of life in terms of medical care. You could fill that document in now, and in 3 or 4 months or in 12 months' time, make a diary note to review that document, to review your advanced care directive, to make sure that that document is still current, that it's still the document that expresses your current wishes at that point in time. And if that's changed at all, to make sure that you let family know, you let the people who will be legally, or the people that you've identified to be legally responsible for you before your death and after your death, make sure that they know of the presence of that document, and make sure that that document is in places where that information can be easily found. And that's probably another whole session Ruth all on its own. But a very important document to start thinking about for anyone to have in place, particularly if you have dependents and particularly if you're facing illness. Beautiful way from a carer's perspective to be able to talk about some of those things. What is it that you want? How can I support you in that? Let's document that. Let's share that information. It's also another way of being able to identify the things that you want to be able to ask for and accept help around. And it identifies those things for your family and the broader community in being able to offer help that's appropriate for you and to have that help accepted. So we've talked about what palliative care is, some of the myths and the legends, the processes and the things that we can put in place to help articulate and document that information for family and friends. At the point of death, an expected death, and this is something that's just important to bear in mind, it's not an emergency. If we know that someone's health is deteriorating, if we know that someone is what we would call an active dying stage of life, so their body is changing, we're aware that death is imminent. Doctors are aware of the condition. Our palliative care team have the opportunity to be involved and support you. And in this situation, just in that picture there, this person has chosen to die at home. And that is a possibility. That is an absolute choice that people can make given the medical situation and given the care facilities, the carer's ability and capability and willingness to actually support that happening as well. So for an expected death, you don't need to call the police or an ambulance. A doctor will need to come and certify the death. So this is the death of someone who it's a known cause. Could be terminal cancer. It could be any life-limiting illness. If the person was expected to die, this is not urgent. The palliative care team can give you more guidance on what to do. So there's a lovely support opportunity there for questions to be asked by carers and people who are unwell of the PAL care team. They're more than willing to provide that information and support services for you, information around how to do that. And that gives people the choice around, as much as possible, choosing to die where they choose to. Could be in a home, maybe in a hospice situation, maybe hospital, perhaps aged care. And that's about empowerment for people, having that choice as much as possible. From a public health palliative care perspective, that approach very much includes the whole of family. So the people who are caring for someone who is unwell, they become part of that holistic focus of care. So when someone has died that you're caring for, it's incredibly important to be able to look after yourself as well as you move through that grieving process. And the palliative care team and staff are a wonderful source of information and support around that. So to take the opportunity to contact those staff, to stay in contact with your doctors, with the professionals that have provided you with that support, and to look after yourself. So losing a loved one is a profound event that can affect you emotionally, physically, and spiritually. So it's really important that you look after yourself. And some of the things that you may want to consider, some of the things that we know help and support during bereavement and grief. Being mindful of diet and exercise, taking good care of yourself by paying attention to your diet, getting regular exercise, getting regular relaxation and sleep. Try and allow yourself time to actually wind down and stop. And use whatever method is appropriate for you. Some people find meditation very soothing. Some people find relaxing with friends another way of doing that. And also to be very realistic and be kind and gentle to yourself. Accept that you need to grieve in ways that feel natural to you, in your way, in your time, with the support of people that you choose. To be a carer is a beautiful experience, and it's very important that as carers we take care of ourselves as well as we take care of the people that we're providing care for. On the screen there are some points of contact, some sources of information. For more information, your friends, your family and your Mito colleagues. So the network and the support group that you have there within the Mito Foundation is wonderful. And you have your colleagues there, you have staff. Australian Centre for Grief and Bereavement, and I won't go through all of those, but there's lovely sources there for more information. Also, if you type in, as I mentioned, Advanced Care Directive into Google, you'll be able to access that document. And there's some wonderful little conversation starters through dyingtotalk.org.au. They're the little conversation cards that can be very useful for families as a little tool to start to raise some of these conversations, as well as the funeral checklist and as well as that collaborative care plan. Some lovely little options there that you might like to have a look at in terms of broaching those conversations with family and friends and carers as well.